Well, unions in New South Wales are already calling on newly elected Premier-elect Chris Minns to deliver on his pre-election promises, including a lift to public sector wages. Joining us live now is Gerard Hayes from the Health Services Union. Gerard, good morning to you. Not wasting any time.
Morning, Pete. It's a good Monday, so we may as well get on with it, I reckon.
So when will you start the fresh wage talks?
Look, I think they'll be sworn in this week, next week. I think it's something that's a very important thing, not only for us, but our members. The HSU has been talking about award modernisation. It's been talking about efficiency, productivity. It's been talking about a Royal Commission into where the New South Wales health dollar is going now. So I think we're in a perfect time to have a revolutionary approach to wage negotiations, which underpin the structural change of New South Wales health.
Is your job easier now that you've got a Labor Premier?
Hell no. It's like hanging out with your family. Sometimes it's easier and sometimes it's not. So, but the fact of the matter is, we have a range of campaigns we've been running for 10 years. We do not do deals with anybody, and we certainly don't do deals with Labor. Like, we have many common interests, but the fact of the matter is we have many competing interests as well.
Right.
And that's we want to see good outcomes for our members and their communities. That's the important part. Our members are part of their community, and I think that's the synergy we have between Labor and ourselves. But it's got to be done soon, and it's got to be done holistically, and it's got to be done for the future, not just for today.
Okay, so realistically, when the new government is sworn in, sometime toward this week, just getting back to that first question there, you get straight into it? When do you expect to get some momentum going?
Look, I would hope within 100 days that we would be in a framework, not only with the new government and the new health minister, but the Ministry of Health, to look at where health is. You know that health's in a crisis. We all know that. We know that there's too many people taking money out of health that shouldn't be. We know that health takes up 1/3 of the state budget. So we believe a full Royal Commission that will look at redistribution of the current funding will go a long way to build health, not only for now, but into the future.
Okay, so within 100 days, you expect public sector wages to have risen?
I know. I expect there be a process in place that actually can identify how they rise, why they rise, because it's important for me too. We just don't want to say, here, give us a figure, because we've got no other idea. We want to be able to say that a paramedic now can treat you in your home, leave you at home to make sure that you don't go to hospital, you don't put pressure on the system, and you don't put cost on the system. We want to see allied health professionals who can actually have patients diverted to them as opposed to the public health system.
So for those who are working in the system at the moment, and of course there's going to be pushback, this is all part of the debate, this is all part of how things get done. So when they might be looking at, when am I going to be getting a pay rise? Realistically, when might they see this in your view?
Yeah. Look, I think it's probably in the last quarter of this year at this point in time. We have for 10 years not negotiated one thing. We've not traded off out of the award, and we're not going to trade off out of the award. If the government wants to seriously talk about award modernisation, take things like incinerator allowances out of the award, which they should, this is something that we want to engage on. We can do this in a robust manner. We can do it quickly. But we can do it thoroughly. And then the community, particularly regional New South Wales, will actually have an option to have a clinician somewhere in their town.
The New South Wales cap was higher than other states. It was double that of Victoria, which was 1.5%. So what is the ceiling in your view now?
Oh, look, the caps are one thing that I don't think really we want to focus on the caps at all. A cap is sort of a reflective. The 2.5% was actually an average of CPI over 10 years. Now that sort of wanes and goes one way or the other. But what we want to talk about is the productivity that people in 2023 are delivering. A sonographer in the public health system's qualifications aren't recognised because they weren't developed when the award was happening. So we've got millennials and others who are doing work that these awards never even gave countenance to. So it's really important that we can modernise, and we can be effective, and we can be productive. We have better outcome for the community and our members.
Okay, but if inflation's running at 6, 7, 8% for the foreseeable future until it comes down, I mean, is that what you're looking at? Above 5%?
Not at all. I'll be honest with you, Pete. I don't have a figure in mind at the moment, but what I do have in mind.
You must have a figure in mind, Gerard.
Hell no, I don't actually. People don't actually understand where I'm trying to go to here at the moment. I am trying to develop a system that is going to be self-funding, and it's not going to be 1/3 of the state budget, and it's actually going to deliver for 300 different classifications within health.
Right.
Also collegiate workforce, no matter who you are or what you do. And at the moment, the first step to actually disperse that funding is to be able to have that Royal Commission's going to identify who's taken too much.
Okay, well, we saw you celebrating there with Chris Minns at the event there on Saturday night, Gerard. Have you had any words privately with him since then?
I had a quick chat with him yesterday, and he and his team are coming together now. I think they are very keen to get on the move within the next week. We are very keen to engage as soon as possible and get things moving. There's a range of matters that we will not agree on. You've seen the ambulance being chalked up for the last 2-3 months. That probably won't stop. The ambulance paramedics are very keen to get outcomes, and so it's going to be a new boss, but business as usual.
All right, Gerard Hayes from the Health Services Union of New South Wales. Appreciate it, Gerard.